Hello, everybody. My name is Aman Chauhan. I'm one of the medical oncologists. I lead our neuroendocrine cancer and co-lead our theranostics drug development program at Sylvester Comprehensive Cancer Center at University of Miami. I would like to thank LACNETS for this opportunity for me to be able to talk to you about this important study, which is evaluating an oral alternative of somatostatin analog in carcinoid syndrome patients. As you all probably know, carcinoid syndrome, it's a detriment to quality of life in a lot of our neuroendocrine tumor patients, especially the midgut NET patients, the carcinoids, and some lung NET patients as well. So we have a couple of really good treatment options for carcinoid syndrome currently in the US. Sandostatin, one of them, lanreotide. I personally consider these treatments very transformative and backbone of how we manage neuroendocrine cancers, especially functional neuroendocrine tumors like carcinoid syndrome. However, there has been a need for a non-injectable alternative to these drugs. And I'm glad that finally we have a study looking at an oral version, a pill form of somatostatin analog. And this particular study fills that void. And so today we will talk a little bit about what this study is about, who can potentially participate and hopefully benefit from it. And this is a poster that I'm sharing with you, which was recently presented at ENADS at 2023. It is a phase 2 study, multi-center, and you can actually find all the participating sites within the US and outside US. There are some South American sites as well in ClinicalTrials.Gov. Now, paltusotine has been already tested in a lot of patients with acromegaly. And in that study, we found that paltusotine is safe and is also quite effective in acromegaly patients. So it was quite natural to test it in metastatic neuroendocrine tumor patients with carcinoid syndrome, because there are patients, as I mentioned before, who are really looking for an oral alternative of somatostatin analogs. So paltusotine is administered as once-a-day pill. In this particular study, we will be testing different doses of paltusotine, and there is some flexibility in that. So if a lower dose is not helping with symptoms, patient can actually get a higher dose pill during the study. In my experience, this is a relatively short and simple and very patient-friendly study. The study is looking primarily at two patient populations. One with carcinoid syndrome who are currently on long-acting somatostatin analog like sandostatin or lanreotide, and the other patient population is newly diagnosed carcinoid syndrome patients who have not yet been on somatostatin analog. So the study does include both of these patient populations. Let me kind of walk you through the bird's eye view of how the study is designed in the study schema. So based on which cohort the patient is being considered for, whether it's a naive cohort where the patient has never gotten somatostatin analog before, or patients currently on somatostatin analog, the first few weeks would be what we call screening. So if patients on somatostatin analog, the patient would be asked to record their carcinoid syndrome symptoms on an electronic diary, which is usually an app on the phone, for a couple of weeks. And what we want to note is that the symptoms are well controlled on somatostatin analog. After that first initial screening period, we will ask the patient to hold the somatostatin analog to see if the symptoms come back. And as soon as the symptom comes back, and if patient meets the eligibility criteria, patient can start the pills. And then we will start tracking if the pills are helping, if they are helping at par with how they were with the shots before, or better, or maybe worse. This is a clinical trial, so this is what we'd like to study. The treatment period of this study is about 2 months. So that's why I said it's a short and simple study. However, after the patient has completed the trial, which is roughly about 2 months of the treatment, and if they were benefiting from the pills, the study has an open label extension where the sponsor would continue to provide them pills for about a year and a half. So since this drug is not available in the market, it's not commercial yet, this is really very important for our patients that they continue to have access to the medicine, especially if they were benefiting from it. The other cohort, which is somatostatin analog naive, so they've never gotten long-acting somatostatin analog before, the screening period is rather short in that because they don't have to be weaned off from somatostatin analog. So the first couple of weeks, they would be asked to log in their symptoms on electronic diary. And if and when they meet the threshold for the qualification for the study, then they can start the active treatment phase, which is when they start taking the daily Paltusotine pills. Again, 2-month treatment period. If they are benefiting from the treatment, they would have option to continue on open label extension, where they will be continue to provide the medication for a 50-week period. So that's a fantastic perk of this study. The other really important thing that I would like to highlight, I'm personally a big advocate for patients for financial toxicity. I do know that besides just the medicine costs and the co-pays, there is a lot of out-of-pocket costs that is inflicted on patients for travel, for a lot of other miscellaneous things. So I'm glad that this particular study takes into account those issues and does help circumvent a big chunk of travel and logistics related costs, which patient might incur during the participation of this study. So something really important to consider, and I think is very beneficial to our patients. Again, to summarize, this is a drug, which is a somatostatin analog, and is looking to see if it can be safely given in Carcinoid syndrome patients, has been tested in a lot of patients before with acromegaly and has proven to be safe. So we would like to see the safety signals in Carcinoid syndrome patients, and we would more importantly like to know how well it works in controlling carcinoid diarrhea and flushing. And so I personally feel it's an important study for us to investigate in this space, not a whole lot of studies in carcinoid syndrome space, and gives a valuable alternative to injectable somatostatin analogs. With that, I'd like to thank you for your attention.